Welcome to Dr. Martin, Head and Neck Radiology. In this video, we will review the radiologic findings of acute sinusitis, also known as acute rhinosinusitis. Let us begin with a clinical case. A 9-year-old girl presented with clinical suspicion of acute sinusitis. A CT scan of the paranasal sinuses was performed, and 3 characteristic findings were identified. First, there was mucosal thickening in both maxillary sinuses and in the anterior and posterior ethmoid air cells bilaterally. Second, air fluid levels were seen in both maxillary sinuses. Third, a combination of mucosal thickening and small intralesional air bubbles was observed in the right sphenoid sinus. These 3 features, mucosal thickening, air fluid levels, and the presence of small air bubbles mixed with secretions, represent the classic radiological findings of acute sinusitis. However, it is important to emphasize that not all findings need to be present in every case. Sometimes only 1 or 2 of them are seen. By definition, acute sinusitis is an inflammatory process of the sinonasal mucosa that lasts less than 4 weeks. It is primarily a clinical diagnosis, and imaging is not routinely indicated for uncomplicated cases. Imaging is usually performed when there is lack of improvement after medical therapy in cases of recurrent sinusitis, for surgical planning, or when complications are suspected. In those settings, CT is the modality of choice because of its high spatial resolution and ability to evaluate both bone and soft tissue structures. The most common CT findings include diffuse or localized mucosal thickening, air fluid levels that suggest active secretions, and the so-called bubbly pattern, where mucosal thickening is interspersed with small air bubbles. These features, when correlated with the clinical presentation, strongly support the diagnosis of acute sinusitis. Differential diagnosis should always be kept in mind. For instance, air fluid levels within the paranasal sinuses are not exclusive to infection. They can also be encountered in patients with recent facial trauma, sinonasal lavage, barotrauma, recent surgery, prolonged supine positioning, or in patients with a nasogastric tube. If you are interested in expanding your knowledge on other important sinonasal conditions, I invite you to watch the video on sinonasal osteoma, key radiological findings. You will find the link in the comments below. In summary, acute sinusitis is a clinical diagnosis, but imaging can provide crucial information in selected cases. On CT, the presence of mucosal thickening, air fluid levels, and the bubbly pattern are the most typical findings, and knowledge of the differential diagnoses is essential to avoid misinterpretation. Thank you for watching. If you found this video helpful, please subscribe to Dr. Martin, Head and Neck Radiology, give the video a like, and leave a comment to share your thoughts. Your support helps us continue creating educational content for the medical community.